Hi friends, if you're wondering how is a knee replacement surgery performed, let us get into the details. Myself, Dr. Ameya Velingker from the Joint Replacement Center at Bone and Joint Care. Let me get you into the details of how a joint replacement surgery happens. If a patient comes to me, which is a likely candidate to go for a joint replacement surgery, we generally give them a set of blood tests to know his medical fitness. Generally, a ECG, a echocardiography, or a stress echo is done to know whether the cardiac function is good. Most of the time, the surgery happens under local anesthesia, which is either a spinal and epidural, or rarely a general anesthesia is given. On the day of surgery, this patient is generally advised to stay at least 6 hours fasting, that is no water, no food, and the patient is moved into the operation theatre. We would prefer a spinal epidural because it will help us to give a good control on the pain management post-operatively. Once the patient is shifted into the operation theatre, the leg is prepared and cleaned with povidone iodine solutions in multiple layers. Most of the time in knee replacement, all the drapes are disposable drapes which are ETO sterilized. We ourselves dress up into a scrub suit and over that disposable dress, and we like to cover our face right with a space suit and a cover so that not a single part of our body is exposed to the air in the operation theatre. Replacement surgeries are mainly performed in a laminar flow, which is a very sterile conditions where the air itself is purified multiple times in a minute, and it is a high atmospheric pressure which is maintained in the operation theatre to have the least infection rate. Friends, in a replacement surgery, it's the most important thing is sterility. Have everything disposable. Nothing should be a contaminant as a source of infection, and let the surgery be as quick as possible. If you feel this surgery is a long process, for me, a knee replacement is just a story of 45 minutes. The shorter the time of operation, the less chances the tissue getting infected. Now, when we prepare the leg, a straight incision on the skin subcut is separated, the muscles are separated, not cut, and we expose the knee. Once the knee is exposed, we put our standard jigs for the tibia and we put standard jigs for the femur, and we take the bone cuts. We reform the bone into a particular shape based on which company implants we want to select. And as the components are ready, we do a trial components, that is we fit the trial implants on the bone and we take it through a range of movement to see if anything is obstructing it. Once we are done, we once again remove the trial implant and we put a glue which is called as a bone cement. It's basically an acrylic cement, and once we put the glue, we stick the prosthesis to the bone and put a plastic in between, and friends, this is your knee. The muscles are once again brought back, sutured in layers one by one, and you are being shifted to the recovery room soon after the surgery, where typically you stay there for around 45 minutes to 1 hour before you are completely recovered and you are safe to be shifted to your rooms with your relatives. Most of the time, if there is no serious medical problems, you rarely get into an ICU setup. Most of the time, you are out in the room, and by evening, once the anesthesia weans off, that's something around 6 to 8 hours after surgery, you are made to stand on your leg and you walk. Friends, most of my patients are scared that, doctor, how will I pass my motions on the next day? But believe me, every patient whom I have operated for a knee or a hip replacement, next morning walks to the toilet, sits on his favorite chair and passes motions. So there is no role for any bedpan, there is no role for diapers, and you are mobile on the next day. What's most scary of a surgery is how long will I be on the bed? And it's less than 24 hours. And mostly in the third or the fourth day is the day when you are happily going home and you will be sitting in your most favorite place on your most favorite bed at home. and you are encouraged to walk every day as much as you want. You are not restricted. You generally come back to my clinic around 14 days from the day of surgery, wherein the stapler pins put on your skin are taken off. A couple of times we even avoid the stapler pins and we do some cosmetic repairs. And I see you back later after a month, and when you should be walking well at your home or maybe outside. I typically allow my patient to go outdoor after a month of a total knee replacement, and in a 3 months time he is free to fly, he is free to see the world, and 95% of the patients have changed the quality of life from where they were to what they have reached. Total knee replacement, as my professors used to say, is one of the most successful replacement surgeries in the world. And friends, if you want to know more insight about joint replacement, stay tuned with this channel. Do share it with people whom you feel may need a knee replacement, and do subscribe our channels for more details. Thank you.